be looking at a few keywords in this case. Are we familiar with what the word lesion means? Have you heard of lesion, hypoxia, anoxia? Okay. Now, to reiterate quickly, a brain lesion typically means where there is some kind of hurt or wound or some kind of pathologic discontinuity that happened in a brain tissue. Anoxia and hypoxia, on the other hand, are pertaining to oxygen deprivation. Hypoxia is a scenario where there is less or limited or reduced amount of oxygen, and anoxia is when there is absolutely no oxygen receiving being received by parts of the brain. Now, hypoxia typically does not have cell death happening as a result, but it will certainly interfere with the functioning of a neuron. On the other hand, anoxia is complete absence of oxygen supply to the brain, and it definitely can have disastrous results. Now, do you remember hydrocephalus? Now, let's say for some reason our ventricles are producing more cerebrospinal. The choroid plexus in our ventricles are producing more of cerebrospinal fluid. Okay, either that, or maybe the cerebrospinal fluid is not getting drained as much as it should have. It's not passing through as much as it should. That could cause build-up or enlargement of ventricles and decreased CSF absorption, increased CSF production, blockages in the ventricular system which do not allow CSF to flow and pass through as it should. All of these things could cause enlargement in the ventricles. That is what happens in case of hydrocephalus. Now, let's proceed to understanding. I hope I'm not going too fast. I'm speaking as slowly as possible so that everyone gets a chance to wrap their head around it. Now, proceeding ahead to cerebrovascular disorders. Now, the first thing that I'm going to talk about here is a stroke. Do we know what a stroke is? In most cases, it is also called as a cerebrovascular accident, CVA, and it is a typical scenario where for some reason blood supply is blocked or disrupted. Okay, and disrupted blood supply to a part of the brain can cause serious damage if at all it is continued for a prolonged amount of time, especially if let's say the anoxia went on for, let's say, more than a few minutes, then the damage that it can cause is pretty much permanent. And anoxia is not the only thing that can cause a stroke. There are other things also which could either be a consequence of a stroke, like let's say there is a hemorrhage. Now, what is a hemorrhage? A hemorrhage is nothing but a fancy term for bleeding. Okay, so if there is hemorrhage, then there could be, say, pockets or space occupying masses of blood that could also develop. Now, this can press on aju baju ka brain structures and can cause impairment there. And why is all of this happening? Because the more accumulation of any kind of fluid anywhere in the brain, be it CSF, be it blood, be it whatever, it increases intracranial pressure, and because of that intracranial pressure, other areas may also get affected. Now, we understand what a stroke is, at least in a brief sense. Now, proceeding ahead, have you heard of something called as a transient ischemic attack, TIA?
Yes, ma'am.
Okay. So a transient ischemic attack typically involves your arteries, your internal carotid artery, your cerebral artery, your vertebral basilar arteries. Now all of these arteries are involved some way when it comes to a transient ischemic attack, and there are some common symptoms of TIA. So some people are disoriented in terms of time, place, or person. There could be sudden tingling or numbness on one side of the face, impairment of speech or loss of speech, be it speaking or understanding दोनों, speech slurry होगा, visual disturbances आएंगे, okay, weakness on one particular side of the body. All of these things are symptoms of a transient ischemic attack. Now, moving on to other things. If at all the ischemic attack is, or let's say even in case of stroke, if it is a severe attack that happens, then it leads to cell death. Okay, जहाँ पे भी damage हुआ, it leads to cell death. So whichever part got affected, whichever tissue died as a result of this lack of oxygen and everything, that area is what we call as an infarction. I will spell it out. Please write down. INFARCTION. I repeat, INFARCTION. Infarction. Now, infarction is nothing but tissue death of that brain area. It is also called as necrosis. NECROSIS. Now, यहाँ तक sorted है? People?
Yes, ma'am.
Yes, ma'am. Now, many a times, blood circulation, in fancy medical terms, vascular circulation. ठीक है? Vascular circulation happens as a result of blood flow stopping. Is this established? Now, blood flow can be blocked or is blocked as a result of, let's say, either there was a blood clot or there was some kind of fatty deposit that was lodged in a vessel or in a particular outlet or whatever. So in the event that there was a blood clot that blocked the blood flow, I repeat again, in the event that there was a blood clot that blocked the blood flow, the fancy term that we use here is called thrombosis. Please write down thrombosis, THROMBOSIS. So thrombosis typically is when a blood clot, aka a thrombus, is formed within the blood vessel and it, let's say, obstructs the blood flow. Now then imagine a blood clot was formed somewhere else and that blood clot traveled to some other part of the body and got lodged there, and wherever it got lodged it created a blockage of blood supply or stopping the blood flow. This particular case of a blood clot is what we call as an embolism. EMBOLISM. Do we understand the difference between thrombosis and embolism? Guys?
Ma'am, in thrombosis, the blood clot is where the blood is like at the same
yes,
place.
जिधर blood clot हुआ उधर obstruction of blood flow, thrombosis. When this blood clot happened at another place, traveled to another place and got lodged there and created a problem there or obstruction of blood flow, that is what we call as embolism. Now, you look at anyone who suffered from, let's say, a heart attack or anyone who suffered from a stroke or a transient ischemic attack, wherever, any kind of attack, the doctor will always speak of something called as infarction. Now, infarction, like I told you, is tissue death. So the damage caused kaun sa part of the heart or kaun sa part of the brain to, wither away, or tissue death or whatever, that is what the term that the doctors would use here is infarction. Yeah, necrosis. Nobody say ye part of the brain mar gaya ya ye part of the heart mar gaya. The term that they use typically is infarction or necrosis. But typically infarction is the term that I have heard most doctors use. Now, यहाँ तक सबको sorted है? Guys?
Yes.
I know this is a lot of medical information and I know this can be a little heavy. That is why I'm going very slowly. So far, the terms that we've looked at include lesions, which is a wound, anoxia, which is absolute lack of blood supply, absolute lack of oxygen supply. Hypoxia is reduced oxygen supply. We looked at hydrocephalus, which is enlarged ventricles resulting as a result of fluid buildup or CSF buildup. Then we started looking at cerebrovascular disorders, within which we looked at stroke, within which we looked at transient ischemic attack. Within that, we looked at infarctions. So we discussed infarctions that are caused as a result of thrombosis, that could be caused as a result of embolism, so on and so forth. Hemorrhaging तो अपने को मालूम है, when there is, let's say, bleeding, the term that we use is hemorrhage. So wherever the hemorrhage is, whether it is intracerebral, whether it is subarachnoid, whether it is anywhere in an epidural space, subdural space, whatever, depending on that you will term it accordingly. Now, do we know what aneurysm is? Have we heard of aneurysms? Have you seen Game of Thrones? Have you at least heard of Emilia Clarke? One person has their camera on and even that person says no. Now, those of you who know of Emilia Clarke, she suffered from aneurysms twice. And aneurysms, she survived them. I don't know if she was lucky or she was strong or both of them, but let me tell you what aneurysms are. Okay? Now, imagine your arteries, your veins, your blood vessels. Purvi, can you please mute yourself? Okay, I did it for you all. Now, where were we? Yeah. So imagine your blood vessels or arteries or whatever. Now, if at all any particular point on that artery or on that blood vessel or vein or wherever the blood is flowing, if that point, if that spot gets weakened, okay? If that point or if that spot gets weakened, instead of the blood flowing through the vein, instead of the blood flowing directly through the vein, it starts ballooning. Okay, it starts ballooning. Now, problem तब हो जाती है where there is a lot of build-up happening, and if it's not detected, which in most cases is not detected, that aneurysm could rupture also, leading to hemorrhage in the brain. That is why aneurysms are extremely fatal. Because उसके कुछ ऐसे symptoms नहीं है ना. Imagine if you have a pimple on the cheek, you can see it, you can burst it, you can apply a cream, you can do something. But imagine something like that happening inside the body where it's not giving you any symptom and you do not have any way of seeing that it is there or getting to know that it is there. That is the reason why aneurysms can be extremely dangerous in a lot of cases. Now, ऐसे नहीं है कि उसका कोई solution नहीं है. As part of the solution, a ring-like stent is put across to restrict the blood flow that goes into it, to ensure that it is not expanding further, so on and so forth. ऐसे भी होते हैं चीजें. Now, proceeding ahead, as a result of any kind of damage to the brain, be it as a result of a stroke or any other condition, there are certain neuropsychological deficits associated with it. Abhi neuropsychological deficits you and I already know, so I will not get too much into it. Let us quickly go through. Necrosis hoga, disinhibition hoga, where people are not able to initiate a lot of behaviors or inhibit a lot of behaviors because they have lost inhibitory neurons as a result of the stroke. So many a times that could also happen. Then there are deficits in terms of certain sensory modality. There are definitely attention deficits or motor or sensory impairments that could happen. Memory deficits, visuospatial deficits, judgment is impaired, you name it, and that is there. In a lot of cases there can be apathy and indifference. In a few cases there could be depression. In a few cases it could also be euphoria, and lack of initiation for some, impulsive emotional responses for some. ये सब भी होता है. Now, are you all with me so far? Am I going faster? Is it at an okay pace for you to understand? I just have two non-verbal cues. I mean, I don't know बाकियों के दिमाग में जा रहा है या जा रहा है. Whatever the scene is, at least all of you who are visibly and mentally present here, can you at least give me a thumbs up for me to know कि तुमको समझ रहा है? समीक्षा, श्री प्रिया, साक्षी, निधि, अफरा, okay, fair enough. I can live with that. Now, proceeding ahead, the next thing that we will move on to is talk about tumors. Now, when we talk of tumors, guys, tumors can have two principal forms. Okay, tumors can be classified in two ways. Pehle to we could be either talking about malignant and benign, or we could be talking about infiltrative and non-infiltrative tumors. Malignant tumors are those which are cancerous, which are very likely to regrow and spread. Benign, on the other hand, are typically surrounded by a fibrous capsule and they will not spread. They are non-invasive, or वैसा, non-cancerous. Chances of them recurring or reappearing are lesser. So benign tumor is still comparatively more manageable. Malignant tumor, on the other hand, is more likely to reappear even after surgical intervention, because कैसा होता है कि तुमने let's say जो भी ट्यूमर था रिमूव कर दिया, सर्जिकल इंटरवेंशन हुआ, कीमोथेरेपी हुआ, रेडिएशन थेरेपी हुआ, सब हो गया, ठीक है. बट लेट्स से फॉर सम अनफॉर्चुनेट रीजन एक एकदम ऐसे मिनिस्क्यूल नैनो एलिमेंट भी उसका किधर रह गया समझो, अनफॉर्चुनेटली it will start proliferating and it will create some other form of cancer some other place. So you look at a lot of people who suffered from malignant tumors, if not immediately, they will be in full remission. All their screens, all their tests, all their everything will be negative, negative, negative. Okay, the family will be celebrating, and of course it is a moment to celebrate. And after a few months or a few years, they'll get to know कि किधर और कुछ और form of cancer also has developed. This is very commonly happening in case of malignant tumors. Why? Because I said wherever it lodged itself, it started proliferating there. And see, this kind of stuff does not happen overnight. Unless it is a very aggressive form, तो भी वो overnight नहीं होता. It takes months and years for it to grow into a tumor. And by the time it gets detected, it is pretty much too late for a lot of people, because initial weeks में या months में, even years में, it is asymptomatic. So I mean, I'm sure we've all seen a lot of cases, if not in our immediate family circle or friend circle, we've seen enough movies or series. कहीं ना कहीं तो ये topics have come, very unfortunately. Now again, I'm digressing a little from the topic, but I am sure you have heard of how there are conspiracy theories revolving around cures for cancer have been found, but there are two, these are very big earnings that pharmaceutical companies earn from, and the pharmaceutical lobbies will never let any, as long as they have control and power over things, they will never let any medication or cure for diabetes and cancer be available to the public, because that will cut off their earnings. This is what the conspiracy theory says. Now, I personally do not know how much of it is true or false, but I mean, कोविड का तुमने बिना जाने बिना समझे 3 महीने में अगर वैक्सीन निकाल लिया, तो समथिंग दैट पीपल हैव बीन सफरिंग फ्रॉम 100 years, यू थिंक देयर वोंट बी एनी क्योर? इतना मेडिकल एडवांसमेंट तो हुआ है, आई एम श्योर वी ऑल अंडरस्टैंड दैट. बट एनीवे, आई मीन, there are many conspiracy theories. I mean, we do not have utna liberty of time to get into all of them. But maybe you never know, in near future things are better for a lot of patients suffering from a lot of things, not just cancer and diabetes, maybe Alzheimer's, Parkinson's, you never know. Anyway, now that malignant and benign are sorted, okay, one more point about malignant. In case of malignant tumors, when they have traveled to other organs through the bloodstream and whatever, and when they have, you know, spread out to other parts of the body also, we call it metastasis. So then that becomes a metastatized tumor or a metastasis form of spreading. This is one additional descriptor. Let's look at the other forms of description, which could either be infiltrative tumors, jahan pe they start eating away or start taking over and destroying आजू-बाजू का neighboring areas also, and non-infiltrative tumor, like we saw before, they are encapsulated in a particular and in a very easily differentiated area, जो आजू-बाजू के area में infiltrate नहीं करेगा. That is why they are called non-infiltrative tumor, but that doesn't mean that they are devoid of any damage. So imagine you have this much area of the brain, and this much area of the brain में there is one tumor that has started to grow. तो जितना वो ट्यूमर ग्रो होएगा, obviously the surrounding areas are also going to be compressed or pressed or whatever as a result of it. तो उससे अगर कुछ dysfunction हो रहा है because one nerve or one part is getting damaged or suppressed or whatever, that can happen. Now, in the notes I have also added a series of types of different infiltrating tumors. So be it gliomas, meningiomas, neuromas, all of these things you can read through. I am not sure what kind of questions will be asked to you in the exam. I don't even know if they are being discussed with you, but in case you are interested in knowing or studying about them, you can certainly go through the notes. Now, proceeding ahead to diagnosis of brain tumors. As far as diagnosis of brain tumors are concerned, obviously you will go for MRI, fMRI, high resolution CT scans and all of that. But वो स्टेज पे तुम तब पहुंचोगे जब भी तुमको symptoms पता हो. Now, very unfortunately, there is no other symptom that we don't know of, or which is a very uncommon symptom. ऐसा कुछ नहीं है. The symptoms for all sorts of brain tumors are pretty much stuff that happens very commonly and very usually. Like, let's say headache, let's say nausea, let's say vomiting. I can tell you 10 different health conditions or psychological conditions that can cause these things. So for a lot of people suffering from brain tumors, they may not even know कि ऐसा कुछ हो रहा है, unless and until things have become उतना profound कि अभी handle नहीं हो रहा है. Then they went to a doctor and then they got to know that ऐसा ऐसा है. Very unfortunate scene, very very unfortunate scene. But there is very little that we can do. But whatever little that we can do, I will discuss with you. सबसे पहले तो you typically will go for surgical removal. But surgical removal will be possible only if the tumor is, let's say, in a cortical area. Okay, मतलब accessible area. If it is in an inaccessible area, let's say thalamus, let's say brainstem, आई एम श्योर इतना तो सबको मैंने कॉग्निटिव साइकोलॉजी पढ़ाया है कि तुमको मालूम है ब्रेन स्टेम किधर है और थैलेमस किधर है. Can you access the thalamus or the brain stem? Absolutely not. So in this case, surgical removal is not possible. So what would you do in this case? Use probably something like radiation therapy or chemotherapy as a primary intervention. ये तुम कर लो. But इसका disastrous effect is that whenever you are undergoing it, there is no control over उसका effect कहाँ जा रहा है. Like imagine a part of the brain or the subcortical area or whatever. Now you want to target this area. Can you only give radiation to that particular area? No. Other areas are going to get affected. Other tissues are going to get affected. So the problem with all of these things, unfortunately, is along with the cancerous tissues, the good tissues are also getting damaged and destroyed. That is an unfortunate result of this. Even in case of chemotherapy, if you see, it f's up the immunity of a person. If you know of someone going through it, or if you have heard of people undergoing it, trust me, it's very very painful. Not just physically painful, but also emotionally painful. All the it's an invasive, it's a painful procedure, but apart from that, the kind of toll that it takes on the body is also too much. Some of them can get immunocompromised. Their immunities are screwed beyond a limit, and chota mota sardi khasi ka effect also can be quite disastrous for them. That is the reason it is very very important to be very very careful. Not scaring you, but it's my job to give you a good picture of what is happening and what needs to take care of. Now, again TMI, but do you know what cancerous cells feed on? This is not there in the notes, but this is FYI. They feed on sugars. And that is why it is advisable that anyone who's suffering from any kind of cancer should absolutely stay away from any kind of sugar element, because the more sweet they are consuming, the more those tumors are growing. They will even otherwise grow, but at the end of the day, if they are not getting any form of sugar, eventually they will not grow. Are you getting what I'm saying? Because they are getting their energy, they are feeding off that sugar. Now, then there are some other uninformed illiterates also in our country who think, हाँ मैं मीठा नहीं खाऊंगा तो मेरा ट्यूमर ग्रो नहीं होगा. But तुम कुछ भी लो, you look at the nutritional content on whatever you purchase, or whatever edible thing you eat, even if it is purely carbs, उसमें भी sugar रहेगा. Even if it is purely protein, उसमें भी sugar रहेगा. So we are talking of all those micro macro nutrient level things. But anyway, proceeding ahead, the next thing that I shall now move on to is head injury. Now, when talking of head injury, I am sure we know that there can be, let's say, closed head injury or penetrating injury. Penetrating injury is when something has, disclaimer, can be barbaric. I'm not showing pictures here. They are there in the notes. You can go through them later. But if there is any kind of piercing happening through the skull or through anywhere else, that is typically a penetrating injury, as the name suggests. When there is no penetration happening of any rod, any screw, anything, but there is a huge blow to the head, that is what we typically call as closed head injuries. Now, before I proceed to explaining closed head injuries better, are you all familiar with fossa, foramina, fontanelles and all that?
No, ma'am.
You all do not know fossa. You all have done the brain, no? Genuinely asking. Have you all done sustenance and protection of the brain?
No.
Huh?
No, ma'am.
Okay. Then you need to give me a minute. Let me find the PPT that I had used for your seniors to teach them this part of the brain. 1 second. ढूंढना पड़ेगा मुझे भी. Okay, yeah, found it. Give me a second to share my screen. Is my screen visible?
Yes,
Planes
ma'am.
of the brain पता है? Coronal plane, horizontal plane, sagittal plane.
Yes, ma'am.
Rostral, caudal, dorsal, ventral, medial, lateral. ये सब क्या है?
Yes.
Yes, ma'am. Very good. Okay. Now, so coming to gross anatomy of the brain, which includes basic protection, sustenance. There are three parts of the, let's say, team. Okay, let's call it the team that is responsible for protecting and sustaining the brain. So the first element that we have here is called fossae. Now fossae are the ridges that we have at the base of the skull. So this is your skull. So ये skull है, समझो ये तुम्हारा skull है. Skull के नीचे जो भी ridges है, ridges imagine it to be ऐसा कुछ thing that can accommodate different lobes of the brain. ठीक है? So fossae are ridges at the base of the skull which are there, like let's say this is your frontal lobe, this is your parietal lobe, this is your occipital lobe, this is your temporal lobe. So जैसे जैसे your lobes are set, वैसे वैसे you will have ridges at the base of the skull to hold that brain in place. ठीक है? So that is your fossae. Then foramina or orifices. Orifices basically are openings for your blood vessels and nerves and everything to pass. Okay? And then you have fontanelles. Now fontanelles are soft openings. Now you see when a baby is born, this is how a newborn baby's skull looks like. Now तुम जो ब्रेन पैदा हुए थे लेके उतना ब्रेन का साइज तो नहीं रहता. Obviously the brain grows. As in how the child is growing, the size of the brain also grows. So that is the reason why we have fontanelles, these soft openings. So जैसे जैसे your brain is growing, वैसे वैसे your skull is also expanding. This is how it looks like at 6 months. This is how it looks like 1 year. By the end of 2 years, it is almost closed. And this is how a baby's brain looks like at the age of 3 years. Now, if you remember, try to remember when a newborn baby is, when someone's an infant, when somebody is quite chotu, do you remember the insistence or the uh, emphasis given on sar theek se pakdo while carrying or holding a baby? The reason for that is this: like their skull is not hard enough, their skull is not fully developed. So any kind of damage at this point could be disastrous. That is why everyone's told to be extra careful while handling a baby, especially the head and the spine and the neck area. Now, do we understand fossae, foramina and fontanelles? Have you all seen the ventricular system? People? Guys? Okay. Okay. So we know choroid plexus, we know where ventricles are, creating CSF. We remember intraventricular foramen, we remember cerebral aqueduct and all of that. Do we? Okay, very good. Very good. Now, so you've just looked at fossae. So you've seen how there are separate ridges to accommodate different parts of the brain. And in case of a closed head injury, the very skull which is there to protect the brain could be that hard surface against which that brain apophyes or bangs against, and that bony scaly structure of the fossae can cause more damage in case of a closed head injury. Now, you all with me so far? Just give me a minute to plug in my charger. मेरे लैपटॉप का बैटरी थोड़ा लो है. Guys, is it getting TMI or are you all able to process information? Able to process. Fair enough. Thank you, Afra. Other people सो गए. सो गए. उन्नति and Somi are like, नहीं हम जागे हैं. Other people, okay. Ketki, thank you. There are 29 of us here, and apart from 5-6 people, what are the others doing? जब तक मैं चीखू चिल्लाऊं नहीं तब तक तुम रिएक्ट नहीं करोगे. ऐसा कुछ है तो पहले ही बोल दो. I can do a lot of चीखना चिल्लाना चिल्लम चिल्ली. I don't enjoy it. That's a different story. Anyway, jokes apart, proceeding ahead. Now, assessing brain injury. ठीक है? Now, when we talk of assessing brain injury, have you guys heard of the GCS, Glasgow Coma Scale? So for every dimension there is a score. So there is one dimension for the visual acuity, one dimension for motor processes or responses, one dimension for verbal responses. ठीक है? So अगर people are able to open their eyes and blink at you in order to respond, or if at all they are not spontaneously opening their eyes, yeah, only when there is pain they are opening their eyes, yeah, no opening of eyes at all. So for everything that I mentioned, there are different scores. So for let's say spontaneous opening of eyes, a score of 4 would be given. When somebody comes and talks to people and in response to someone else's speech, if they are opening their eyes, then it's a score of 3. या फिर कुछ painful stimulus to the limbs or to the chest, only when there is a painful stimulus, if they open their eyes, a GCS score of 2 is given, and when there is no eye opening at all, a GCS score of 1 is given. Verbal response का भी similar, motor response का भी similar. So if at all let's say depending on total score उनका क्या है, you would determine the severity of the coma. If it is between 3 to 5, very severe. 5 to 12 is moderate. More than 12 is okayish and can be dealt with. There are a lot of what do you say, variations in what people consider as low, moderate and severe, but nonetheless this is how it works around.
I'm sorry ma'am, but can you repeat the name of the test? I missed it.
Glasgow Coma Scale, GCS as it is also called as. Like nobody is going to say, hospitals वगैरह में तुम देखो, nobody is going to say Glasgow Coma Scale is 15. They're going to say GCS 15, which is the max that one can get. GCS 3 is the lowest that one can. The range of GCS is between 3 to 15. Now, after this we have stuff like क्या क्या होता है exactly. So let's say for example, if there is swelling in the brain as a result of severe brain injury, the fancy term for swelling is edema, EDEMA. So problem with brain edema is there is no space left for the brain to swell also. ठीक है, अभी तुम्हारा स्कल है और तुम 3 साल के तो सर्टेनली नहीं हो, तुम 20 साल के हो, या whoever adult, not you specifically. There is limited space inside. It's not like the brain, the skull is now going to expand to, incorporate the growing brain or swelling or whatever. So that brain has no space to swell into, and that increases the intracranial pressure. Okay, so it is very very important for people to routinely monitor a catheter into the ventricles or subarachnoid space to see कि ICP कितना है. ICP is intracranial pressure. So edema, ये brain swelling is one thing. Apart from that, if there is let's say any kind of hemorrhage, okay, hemorrhage like I said is bleeding, or any kind of tumor or any kind of infection that will displace or deform the brain. And this displacement or deformity in the brain, fancy term for it is the brain herniation. HERNIATION, brain herniation. Now, any questions so far, anyone?
No, ma'am.
Okay.
What would displacement mean?
Where, because let's say of the pressure that one tumor, for example, is creating on the surrounding areas, the surrounding areas could get displaced or deformed in this case. It's not the kind of displacement that you and I understand in terms of defense mechanisms. The displacement here is in terms of moved from its original place or changed its original form or shape. That is what we mean by displacement in this case.
So this happens due to the swelling?
This happens due to swelling, due to tumors, due to hemorrhages, due to infections, due to multiple reasons. Any kind of brain injury, when it causes some kind of deformity or displacement, this process is what we call as brain herniation. And most of the times it is caused as a result or associated with some kind of increase in intracranial pressure.
And the condition where the CSF leaks from nose, or which is that?
So see, that could happen when the blood-brain barrier is breached, or where there is some kind of, let's say, lesion or wound somewhere in the CSF as a result of which it is leaking, but it's an extremely rare condition. Otherwise, if you see the beauty, like I'm sure you all have studied this in greater detail when you were doing the ventricular systems and the vascular systems and all of that, and the beauty of this thing is they're very high in integrity. Integrity, not morality terms, but integrity of the strength in which these systems perform. So because the integrity of the vascular system, the ventricular system is very strong, it's a very very rare case occurrence that this happens. And let's say even in case of hydrocephalus wala scenario या craniosynostosis wala scenario also, today, touchwood, with the help of medical advancements, we have interventions like putting a stent or a surgical intervention jahan pe things can be controlled and managed. The only thing is they should get timely intervention, तो ही ये होता है, otherwise it's very difficult. But anyway, I feel sometimes early detection, early intervention, and sometimes to do with luck, awareness and knowledge of things also is very very important. Like at no point can we say कि एक factor ही important है. There are multiple factors which are associated in the scene. Now, people like you and I who are studying about these things, we are aware, we are familiar. We know that अगर frequent headaches हो रहे हैं तो crocin pop नहीं करना चाहिए. You should go and show it to a doctor. ठीक है? We know. But despite us knowing also, we may not go to the doctor. Why? Because we are like, we will find a way to rationalize. Like I told you guys last time, I was waking up fatigued constantly, but I automatically assumed it is lack of sleep. I automatically assumed it is work stress. But it was not. I mean, of course, work stress है. That doesn't mean कि work stress मेरे को नहीं है. But the reason for waking up fatigued despite sleep was not fatigue, it was sleep apnea, right? And it's not like I did not know sleep apnea, I knew. But the kind of sleep apnea we study and the kind of sleep apnea sometimes can manifest is very different. That is the reason why I say one should not gamble with one's health. I mean, the wrong time to be saying this to you, but I'm saying this in all honesty, that nothing is worth compromising your health. I know this is the wrong time for telling this to you because you are in the process of completing your semester and studying and all of that. But trust me, today, if somebody asks me, like, trust me, it's been over a decade since I was studying and I completed my master's or whatever. Today, if somebody asks me if that was worth it, 10 years ago, if somebody would have asked me the question, I would have certainly said yes. It was worth it topping Mitibai. It was worth it being the first ranker of Mitibai. It was worth it being the student of the year in Mitibai. Not flexing, genuinely telling you. 10 years ago. Today, if someone asks me that question, I will say no, don't lose your sleep over it. Don't F your health beyond repair that you can't do anything and you're going to regret 10 years later. Because there is no going back. I'm sorry if the timing of this is awful for you, but I mean, again, I'm not saying don't study. I'm just saying don't do it at the cost of your health. इतना smart हम सब है that we can do a cost benefit analysis for ourselves. Do whatever you can best do without damaging yourself in the process. That's all I ask for. That's all I am trying to bring to your notice. I'm not saying padho mat. I'm not saying go push yourself. I'm not saying YOLO, bhaad mein gaya sab. No. What I'm saying is find a way to balance your work, in this case studying, and your health, because neither of them can be compromised. Now, any questions so far? As far as damage, as far as brain injury or cerebrovascular disorders or tumors were concerned, we've pretty much covered quite a lot of things. As far as brain damage is concerned, okay, we must have heard stuff like concussion, contusions, all of these things. Do we know the difference between the two? Okay. So when there is impairment, मतलब ऐसे कुछ bleeding हुआ नहीं है, but ऐसे temporary impairment in brain function could be because of a closed head injury or whatever. That is what we call as a concussion. A contusion, on the other hand, is when there is some kind of bruise or bleeding in the brain. ठीक है? Penetrating injury, closed head injury, we've already done. Acquired injuries may, you could either have a stroke or a tumor or infection or inflammation or whatever. What are the most common causes of brain injuries? Maybe a blow to the head, a motor accident, या कोई किधर गिर गया, stuff like that. Alcohol and brain damage is also very, very closely related. So people who are heavy drinkers, मतलब ऐसे ओकेजन पे ड्रिंक होके टुन होने वालों को मैं हेवी ड्रिंकर नहीं बोल रही हूँ, जो रोज पीते हैं, ऐसे काफी ज्यादा क्वांटिटी में पीते हैं, एंड दे आर ओनली ड्रिंकिंग, दे आर नॉट ईटिंग एनीथिंग, they're only drinking, they're not eating anything. In that case, extreme cases like such can cause brain damage also. And this condition is what we call as Wernicke-Korsakoff syndrome. When drinking only or consuming only alcohol starts impairing brain functions, and that can have a long-lasting damage. Okay? It can lead to impairment in vision, muscular coordination, speech, everything. Now, symptoms. Anything associated with brain damage, symptoms are general, very general. Balance affect होएगा, vision affect होएगा, orientation affect होएगा, memory problems, speaking problems, so on and so forth. Diagnosis here also again pretty much the same thing. CT scans, fMRI scans, MRI scans, all of that. Treatment options here also, again, you will either have a surgery or some kind of occupational therapy or speech therapy and all of that. Now, that brings us to the last two topics that I want to discuss with you. One is neuroplasticity and the other one is rehabilitation. Now, before I proceed to neuroplasticity and rehabilitation, do you all want a 10-minute break? Okay. It is almost 4:40 in my watch. How about we resume at 4:50? Would that be okay with you all? Okay, fair enough.
अरे खाए बच्चा ठीक है तो डब्बे बना के छोड़
ऐसे भी बना के खा ले काम कहीं होगा तो कहीं भी तो बनावट चाहिए तो देखना
काट के लगे तो बना के खर्चा हम बना के थोड़ी करें तो अगर तो मेन बात है थोड़ा सामान खाते लोग तो किसी किसी बीमारी तेल खाते मसाला खाते हैं और कुछ
तेल मसाला मटर लाल मटर होगा और वो रखो चौरा रहते हैं निकाल लो तो भैया आता लोग मांग लो बता दो कर जाता है लोग सुबह सुबह मांगे जान मंगवा था
ठंडा थोड़ी दो पाते वहाँ तक जब पानी दो पाते हैं जब आगे करना है भगवान के बंदे की चावल घूमते कभी चावल में तो 1000 रुपये 1100 चावल 15 किलो 20 किलो मांगे तो चावल चावल तैयार कर दिया 1000 रुपये देना पड़ गया 1000 रुपये कमा करो बाद में चावल करके जा रहा हूँ 2000 के मेरा घूमते तो सवाल लगा मारवाला है
तो ये फर्क है
वो भरवा था उधर भरेगा हम अगर खर्चा कर हम भरा देते ऐसे भी तो नया लगे तो भरवा करता नहीं जिससे करके अगर एक महीने फिर वो कर दिया एक बार भरवा पाता ना भरा तो रुपये पर बना लगे तो मैं घर रखा
ना अगली बार देख ला काफी बोलो काट अगली बार खा सकती हाँ नहीं अभी जगह की नहीं जा रहा हूँ जगह देखिए डाल के खाए पर करता ना अपन करे भी ना पर खाए भी ना पाते बाबू पूछ लिया जो मेरा काटा देते मेरा आगे चलो बताओ तो फिर कदम की खाए की तोरा फिर बाद में तोरा फिर झंझट करो बोलो हम कहना पर से बोल अभी मेरा कुछ नहीं कभी घर बोलो ना भी कहना तो
Somebody. I wish I could give you all internals ka marks for this. I knew who to give +5 for that. Anyway, chalo. Shall we proceed to the last bit of our series? Now, I will first be talking about neuroplasticity with you. Conceptually, I'm sure we all understand what neuroplasticity is, correct? Now, when our nervous system, technically, when our nervous system has the ability to change itself as a result of a response to some intrinsic stimuli or some extrinsic stimuli, by reorganizing its structure, by reorganizing its functions or connections to each other, this is what we typically call as neuroplasticity. Okay? Now, initially, people were not as smart as you and I are. Okay? Initially, people were dumb. And they thought that the brain stopped developing after the first years of life, after the first few years of life. And they thought, if you remember studying critical periods and sensitive periods in developmental psychology during SYBA, you may remember what a critical period is. Okay, something that can only develop during that point or something like that. So it was once believed that growth and development of the brain happens typically in the early childhood, or when the child is quite young, and that is what was termed as a critical period for brain development. And people at that time once believed that after that the brain stopped developing. And because of this belief, scientists also were of the opinion कि ठीक है यार, अब तो डैमेज हो गया, अब तो परमानेंटली लॉस्ट, अब तो कुछ ही नहीं कर सकते. But later on, okay, there were more people who had other ideas. And you know, in psychology, who started it? William James. William James was the first person to present the theory of neuroplasticity in his book called The Principles of Psychology, which was written over 100 years ago. And it was William James who suggested that the brain is capable, human brain is capable of reorganizing itself. Obviously, the term neuroplasticity was not coined by William James. The term neuroplasticity was first used by a Polish neuroscientist called Jerzy Konorski. Okay, Jerzy Konorski, Konorski. It was this chap who suggested that over time, apna neurons are having coincidental activation because of neurons everywhere else firing, and that is creating certain plasticity related changes. Okay, and later on, as in how the advancements of science happened, as in how better methods of brain imaging were developed, okay, latter half of the 20th century, people actually came to realize the importance and the prominence of neuroplasticity. This was a brief gist of history towards neuroplasticity. Now, by now we've established that, you know, throughout our lifespan, jitna new experiences you go through, utna naya changes, structural changes, functional changes, synaptic connections related changes are happening in our brain. And what makes it possible? Neuroplasticity makes it possible. Okay? And for that we have a few principles. Okay, the first one that we have here is called the plasticity hypothesis. Now, what is the plasticity hypothesis based on? The plasticity hypothesis is very primarily based on apna nerve impulses ka activity. So whenever our nerve impulses are activated, whenever there are any changes happening in the nerve fibers, especially at the cortical level, okay, they will lead to some transformation in carrying out the excitability or the action potentials over here. Okay, and that enhances these changes, and this enhancement would lead to a neuroplasticity. Taking this one step ahead, there is another law pertaining to the neuroplasticity hypothesis or the plasticity hypothesis. The law says functional changes lead to structural changes. Now, what is a functional change? जो भी तुम आज कर रहे हो, it's temporary, right? Whatever you're doing once or twice, whatever you did today, it is थोड़ा बहुत temporary. But the more you practice it, the more habituated you become to it, the more ingrained it becomes at the structural levels also and causes a structural change. Now, I do not know if you remember this, but try and remember it now. For any random thing that we do, be it a new habit that you're trying to inculcate or something new that you're trying to do, why is it that after a point हम वो शिद्दत से नहीं कर पाते, या whatever you are trying to imbibe and establish is not working out and it's not becoming a habit? The reason or the answer to that is consistency. So if you start off a thing, let's say reading, okay, I'm sure we've all had phases जहाँ हमको knowledge gain करना है तो हमने Amazon shopping hall पे ऐसे 10-12 books मंगा लिए and we like कि नहीं every week I will complete reading one book at least ये वो. I'm sure we all like all of us who are into reading have a stack of pile like that जो हम बाद में leisure reading करेंगे करके लिया था and फिर वो बुक कभी खोली नहीं और वो एक बार जो रह गई ऐसे हो जाता है. But anyway, coming back. So the reason why that happens is because maybe you read today, you read tomorrow. तीसरे दिन छोड़ यार नींद आ रही है सो जाते हैं भग रहा है या असाइनमेंट है ये है वो है whatever may be your rationalized reason, you didn't do it. So that never became consistent enough to cause a structural change in the brain. It takes 21 days of consistency to form a pathway. एंड ऐसा नहीं कि आज 10 दिन किया फिर 5 दिन आराम फिर और 11 डेज किया तो होगा. नो, 21 consistent days of doing it every day. But, and this is a big beauty but, 21 days किया उसके बाद और 10 दिन नहीं किया तो it's not going to stay constant. Obviously that is also going to lose its influence, lose its effect. So that is also something that we need to remember when we are trying to form a habit, be it a sleep-wake cycle, be it a studying habit, be it any kind of thing that you're trying to inculcate in your daily life. Consistency is the key. Now I'm going to take 2 more minutes to digress from this because this is important information again said by William James only. Now you know ये जो हमारा you know sometimes we give in to certain impulses, like you know especially if you're on a very strict diet or you're on a very strict regimen या whatever, and we have this thing like you know एक दिन से क्या ही फर्क पड़ता है यार, एक दिन से कुछ नहीं होगा. And be it me, be it you, we've all given into these impulses, we've all given into these temptations. But understand, वो एक दिन या वो एक इंसिडेंट ऑफ चीटिंग या एक इंसिडेंट ऑफ गिविंग इनटू दैट टेम्पटेशन is not going to stay limited to that one incident. Look at it very objectively and look at it very biologically also. For you it may be one instance, okay, for you it may be one instance कि ठीक है ना चल आज डाइट फॉलो नहीं करेंगे, आज जिम नहीं जाएंगे, आज ये नहीं करेंगे. One instance, and you may think that one instance will not make much damage because मैंने 50 बार 50 दिन ये फॉलो किया, अभी एक दिन नहीं करूंगी तो क्या ही तूफान आ जाएगा. तूफान आएगा वो biologically आएगा. Why? Because you are thinking one incident but multiply it into a billion times because that is how many cells you have in your body and that is how many elements in your body are living it. So that one cheat day that you had or that one ठीक है ना एक टाइम से क्या ही फर्क पड़ेगा वाला scene that you had, that has replicated a billion times throughout your body. So that one incident is also going to leave a significant biological impact and thwart आगे का consistencies. So trust me, I'm not enjoying telling you this, but this is important for you to know because this is how routines, regimens are screwed over time. Because we can never fight our biological information. What information is received biologically, हाँ ठीक है ना इतना important नहीं था इसके लिए break कर दिया. And that is where cravings, that is where all of these things come into picture. Don't look at it in a very boring or a very neutral way. Look at it in a very personified way. Look at it in a very metaphorical way, in a very personified way, and you will realize that if you can crave for something and get it once, in terms of human behavior, you can crave for something twice and also get it twice. And there is no limit to this kind of impulse. That is why it is very important to maintain discipline. Now don't worry, मैं इतने लंबे भाषण दे रही हूँ discipline पे. I have also not been able to, you know, stick to that regimen all the time. There are times that even we have had cheat days and everything. It's not humanly possible to always stick to a regimen. We are not robots, we are humans. But it is all, you know, life hangs in between creating the balance between these things. वो तुमको करने आना चाहिए. Anyway, now that, yes, Afra, go ahead.
So ma'am, why is it difficult to restart something than to start something? Like I can, get a hype, I'll start reading and everything, but once I give up, restarting it becomes more difficult.
Because when you have given up on it, you would not want to go back to something. Like if I can give you a personal example, अगर for some reason मैंने एक बुक पढ़, very rare दो, एक बुक पढ़ना चालू किया या एक सीरीज देखना चालू किया है, for some reason वो छूट गया. It's very difficult for me to go back to that book or go back to that series. वो नहीं होगा. I probably may start reading another book, start watching another series, completed also. But ये वाला नहीं होगा. I feel if I have to give you an explanation, sometimes it can be an unconscious block also, because going back to it every time is a constant reminder that you left it midway, and it is not a comfortable thing for any of us to know, especially those of us who take pride in these possessions, or those of us who take pride in these attributes. So that is one explanation. From a neuroscientific perspective, sometimes it's like you're bored, you are done with it, you're not interested in it. ऐसे सब भी हो जाता है, and once you have dissociated from it, it's difficult to go back to it. And a point to remember over here is that it's not impossible. It may be difficult, but it's not impossible. So if you set your mind and heart to it, you can complete anything. But then again, बात वही आती है ना कि मन नहीं कर रहा तो कहाँ से complete करे. That is also a very big deal. That is the primary reason why I genuinely suggest कि अगर तुमने चालू किया है तो खत्म करके ही छोड़ो, because एक बार वो बीच में छूट गया तो वो छूट ही जाएगा. How many of us have gone through something like that? Be it in terms of reading a book, watching a series, or learning a new language, learning a new musical instrument. वो छूट गया तो छूट ही गया. A lot of us. Comforting to know I'm not the only one. Thank you, guys.
Ma'am.
Yes,
So
Aura.
is it easier, or is it easy to give in your temptations in, say, the first 1 week, and then it becomes difficult to give in the temptations like after
It's
21
very
days?
subjective, Afra. To be very honest, it is very subjective. हर एक का सीन अलग होता है. It depends a lot on what your priorities are. It depends a lot on what it is that you want to do. In terms of biological information, I will tell you neuroplasticity सब में similar ही function करता है. Like I said, functional changes will lead to structural changes. So if you set your mind and heart to it, and if you start doing it, तो ऐसे नहीं है कि neuroplasticity आएगा नहीं. Obviously, if you do it consistently enough, neuroplasticity will enable structural changes and become a part of a habituated routine or whatever. But वो करना या नहीं करना ये तुम्हारा choice है. Neuroplasticity as a concept exists in all of us. But are all of us able to make most of it? No. That is where subjectivity comes into picture. That is where motivations, priorities, discipline comes into picture. I hope I have answered your question.
Yes, ma'am. Thank you.
Welcome. Now, guys, proceeding ahead to neuroplasticity. Now, any questions so far, anyone? We've understood the plasticity hypothesis. We've understood how consistent functional changes can lead to structural changes at the biological level also. Now, proceeding ahead from this point, there is a certain there are a certain set of mechanisms that govern functional changes. There are 2-3 of them. Let us first look at each of them carefully. सबसे पहले what we have is something that we call as denervation supersensitivity. Denervation supersensitivity. Now, do you want me to spell it out for you? DENERVATION, denervation supersensitivity. Now, denervation supersensitivity is something that typically occurs when cortical neurons are lost. Okay? So, because of that, whenever there are, say, damaged neurons, no nerve signals are passing across these neurons. So, therefore, to compensate for this, all the postsynaptic membranes that we have, they develop more receptors for neurotransmitters to pass nerve signals. So as a result, what is happening? There are increased receptors, and these increased receptors are increasing the supersensitivity. That is why we call it denervation supersensitivity.
Ma'am, can you repeat it once? I couldn't
I
get
will.
it.
I will repeat again. So imagine cortical neurons are lost. Okay. Now because these neurons are lost or damaged or whatever, इनके through कोई nerve signal pass नहीं हो रहा है. So to compensate for this, what is happening is in the other postsynaptic neurons, in the other postsynaptic membranes, there are more receptors being created. So because there are more receptors being created or more receptors being developed, the neurotransmitters are able to pass a nerve signal better. क्योंकि the more receptors there are for neurotransmitters, the sensitivity of postsynaptic membranes will also increase. This leads to a better conductance. Hence we call it denervation supersensitivity. So because some neurons are lost or damaged, there are no signals passing through it. So what we do is we compensate for this by our system creating more receptors for neurotransmitters, so that the existing ones can pass nerve signals with better conductance in a more sensitive manner. ये समझा guys? Make sense? हाँ ना ओके ठीक है something. Okay. Now the next thing that we have over here is called long-term potentiation. Now let's say there is a brief amount of time where your synaptic connections were strengthened persistently because of high frequency presynaptic activity. That is what typically happens in long-term potentiation. When synapses ka passing of messages or transmission of messages is consistently and persistently getting stronger, okay? And because of that, it enables your synaptic transmission in a neuronal network. Now, a lot of things are included over here, be it glutamate, be it an influx of sodium, be it NMDA being blocked, that leading to further release of glutamate. All of these things together are causing long-term potentiation. And in a nutshell, what you need to remember for long-term potentiation is that your synaptic transmissions are getting strengthened. Now, that brings me to the next topic. What is synaptic strengthening? Synaptic strengthening is the process where your synapse itself goes through structural changes so that neurotransmission can happen faster. So imagine plasticity का concept being applied to the synaptic transmission wala scene, so that information can pass from one point to another faster. This is what is happening in synaptic strengthening, facilitated neurotransmission. Makes sense? समझ रहा है, नहीं समझ रहा है, क्या हो रहा है? Do you all need me to go over them once again? We are understanding?
Yes, ma'am.
Okay, fair. So far we've looked at three things under mechanisms of functional changes. We've looked at denervation supersensitivity. We have looked at long-term potentiation. We have looked at synaptic strengthening. Okay. Now, when talking of structural changes, obviously functional changes होंगे तभी जाके structural changes होंगे. All these things that we've discussed, the denervation supersensitivity, long-term potentiation, all of these things are mechanisms of functional changes. Now let us look at structural changes. Now when talking of structural changes, obviously stuff like sprouting and pruning and spine density, receptor density, dendritic axonal density, all of these things come into picture. But apart from that, plasticity, the concept of plasticity itself, as given by Kolb and colleagues, there are three main types of plasticities. First one is called experience independent plasticity. Second is experience expectant plasticity. And the third one is experience dependent plasticity. Let us look at each of them very carefully. Now, when I talk of experience independent plasticity, this is typically something that happens in the prenatal development period. Okay, so this is the time when neuronal connections and brain formation is completely driven by genetic instructions. Okay, and neurons are getting created, they are firing together, they are getting structural changes, parts of the brain are being created, some of them are not in sync, some of them will sync, some of them will eventually wither and die out, and all of these things are what is typically happening in experience independent plasticity. Experience independent plasticity is the prenatal development phase. यहाँ पे I do not know if you have studied this before in unit 1 or whatever, but if you look at prenatal development or prenatal neural development, you will realize that initially there is overproduction of neurons. मतलब अगर तुमको इतना चाहिए रहेगा, इतना प्रोड्यूस हो रहा है, and the extra ones that you don't need are then later of pruned. Okay, this particular thing, where most of our neurons we possess when we are youngest, and gradually we start losing gray material. ठीक है, but वो बात की बात. Coming back, I want you to remember neuronal connections, brain formation that happen in the prenatal developmental period is what we call as experience independent plasticity. Because that is the point where you are not exposed to the outside world, you are not familiar with anything in the outside world, you are pretty much in the mother's womb, you are not even a baby yet, you are still a fetus, right? Or an embryo, to be precise, embryo and fetus. That is experience independent plasticity. Is this clear for everyone, guys?
Yes, ma'am.
Okay. Now, proceeding ahead to experience expectant plasticity. Now, experience expectant plasticity is something that typically happens in the early postnatal development, because this is the time when environment के वजह से a child is listening to, exposed to different speech sound, different visual stimuli, different auditory stimuli, and as a result of all of these exposures to colors, to visual sides, to auditory sides, to olfactory, gustatory, tactile stimuli, sensory stimuli, the children learn to distinguish between different sorts of things. And this is where connections of neurons are formed. This is let's say built as a result of experience. Okay? And experience expectant plasticity is something that begins in early postnatal period and pretty much continues throughout your lifetime, because this is your so-called enriched experiences in life. So तुम जितना नया चीज सीखोगे as a result of experiencing something, okay, as a result of exploring something, or as a result of being exposed to something, that is what we call as experience expectant plasticity. Are we clear with the difference between experience independent and experience expectant? People? No.
Yes, ma'am.
Okay, now we shall move on to the last type of brain plasticity, which is called experience dependent plasticity. Now, most students goof up between experience expectant and experience dependent plasticity. ठीक है? Experience expectant plasticity, like I said, is something that starts after you are born, and जितना तुम नया information सीखोगे in terms of discriminating sounds, discriminating visual stimuli, discriminating olfactory stimuli, it is all experience expectant plasticity. Experience dependent plasticity is also seen throughout life, but experience dependent plasticity is something when your brain changes as a result of different situations that you are exposed to. Like let's say for example kuch injury ho gaya, okay, let's say for example for some unfortunate reasons kuch you suffered from some kind of injury, and that created a challenge, a learning challenge, a communicating challenge. It created some kind of challenge for you. And as a result of that challenge, you had to, let's say, learn a new way of communicating, or, learn something new in order to overcome that challenge, okay? Which required your synapses to increase, or to become some brain areas to, let's say, proliferate, to compensate. This is where plasticity becomes experience dependent, okay? And forget dependent, expectant, independent, whatever. At the end of the day, plasticity can be explained using two statements. First statement, functional changes lead to structural changes. तुम function, तुम behavior, तुम action में change लाओ, consistent रखो, structurally also things will change. This is first principle. Second principle, I mean, we belong to that generation that we have grown up listening to stuff like family that eats together stays together. So dramatically applying that to plasticity wala context, you can say that neurons that fire together are wired together, if that makes sense. Now, this is pretty much what we have under neuroplasticity. The next bit that I will be discussing with you is a basic neuro rehabilitation model. Now, I am sure we all understand that when we talk of neuro rehabilitation, it's not a one man's job. You need a team of multidisciplinary specializations, be it in terms of assessment, be it in terms of therapy, be it in terms of nursing, be it in terms of occupational training, whatever. So basic neurodevelopmental या basic neuro rehab model will include medical services, will include a neuropsychologist, will include a neurologist, will include a psychiatrist, a physiotherapist, an occupational therapist, speech therapist, all of the above, right? And any kind of, you take any kind of neuro rehabilitation intervention, all of them are based on brain's regenerative potential. Okay, I am sure we've all grown up studying about how brain damage is permanent and brain में damage हो गया तो लग गए boss. We've all grown up reading, studying, being scared, being scarred through all that information, which is true, but to an extent, because the other side of this extent we also have the brain's regenerative potential. I am not saying regenerative power, I am saying regenerative potential, because it is capable of reorganizing itself. Now, before I proceed further, I would like to ask a quick question. How many of us are genuinely interested in exploring neurorehabilitation in further details? This is not a tricky question or whatever. Okay, Unnati. So me, fair enough. For all of you who are genuinely interested in this particular exploring this further, I will add a few links to the notes when I send it to you. You'll have to give me a few minutes to send the link. in the notes itself I will add the links where you can see how this work is actually being done. Okay, there are a few techniques like a constraint induced rehabilitation or prism adaptation that happens for, let's say, people suffering from spatial neglect. Then there is transcranial magnetic stimulation. Have you all heard of these things? Have you heard of constraint induced therapies? Okay, so to give you a brief gist, there are multiple theories, multiple therapies that people have initiated, that people have developed in order to help with, neuro rehabilitation. So सबसे पहले what we have is constraint induced movement therapy. Now what typically happens in constraint induced movement therapy is you are taking the help of very intensive, experienced based, repetitive motor training. So iska logic is the more you repeat a movement, even if somebody is not, like let's say somebody suffered from a stroke, they are not able to make use of their arm, तो उनको ये movement, okay, उनको ये movement जम नहीं रही, उनका because of the stroke, because of infarctions, ये rigidity है, this is not able to move. So let's say this AC remote, they'll not be able to hold like this. So धीरे धीरे ऐसे, ऐसे, the more they are using it, the more they are made to use it, exercise with it, it will get better. So this entire constraint induced movement therapy is based on experience and repetitive motor training of the limb that has lost function. But in case those of you who are listening to what I am saying properly are using your brains, you may ask, movement therapy समझा, because repetitive motor training हो रहा है, constraint क्या हो रहा है, what are we constraining? Now assuming that there are two limbs, obviously there are two hands, this hand is affected, this hand mein movement is restricted, but this one is working fine. I can easily pick the remote with this hand and do whatever I have to do with that AC remote. But constraint induced movement therapy works when this hand is immobilized. So जो हाथ चल नहीं रहा है उसको तुमने जो हाथ ढंग से चल रहा है उसको तुमने immobilize किया है, and you are training the other impacted arm. This is what happens in constraint induced movement therapy. Then for people who have suffered from a stroke or a paralytic attack which has left them unable to walk or whatever, तो उसके लिए भी we have something called as a weight supported treadmill training, where similar constraint induced movement training only, but यहाँ पे there are supportive harnesses, like we've all seen a treadmill, okay? So imagine a supportive harness which holds the body, because these people can't walk, they can't station themselves. तो एक supportive harness है which kinds of holds you, and then धीरे धीरे the technician will help you, assist you in advancing your legs at a very minimal walking speed. And the more you practice with this, overnight तो नहीं होगा, ठीक है, but let's say a few weeks, a few months down the line, there are patients who have shown remarkable progress. ठीक है, those of you who are interested in this, you can certainly explore this more, study it more. There are certifications, there are courses, there are diplomas available, not so much in India but abroad certainly yes, and you can seriously give it a good thought as a career option. Now constraint induced movement therapies mein itna hai. Then there is constraint induced language therapy also, where the same logic is applied, jahan pe you are making them practice language. Initially आवाज नहीं आएगा, सिर्फ lip movements होंगे, okay? But in a lot of stroke survivors, especially those who are suffering from aphasia, communication has been improved, language improvement हुआ है, even non-verbal communication has improved. All of these things, using repetition, using the right kind of guidance, training, all of that. Similarly, you have a patient spatial neglect also, and this was developed by uh, Kepler something. I forgot the full name. 1 second. एक second. Kessler Foundation. So it is called KFTAT, Kessler Foundation Prism Adaptation Treatment, where they are treating or helping patients perform manual tasks while they are more aware of their surroundings, where they are told to I mean, of course they are given multiple trials over this, where they are क्या बोलते, there are attempts to show them where they are optically displaced so that they can after training understand कि वो ठीक है ये area भी है which I missed. So there is a lot of motor functional supportive rehabilitation that goes in, but with the help of proper verbal instructions and with the help of experience dependent strategic intervention, you can help with. I mean, this is a very, very controversial thing, but it is something which is being explored, like I said, by the Kessler Foundation, and they have made a lot of progress with a lot of people. And I'm specifically telling you this because I'm sure we've all grown up reading cognitive psychology textbooks since the time we were in TY, knowing that hemi-neglect is pretty much permanent and nothing can be done. But today, after few years of reading that, after few years of studying that, we know that there are people like this particular foundation who have devised certain mechanisms, certain strategies, certain methods to help people deal with it or manage it better. Now, after that, after the prism adaptation training, the next thing that we are going to be looking at over here is what we call as transcranial magnetic stimulation, TMS. Now, what happens in transcranial magnetic stimulation is a strong magnetic field is created and an electric current is passed through a coil that is placed on the scalp. Now it penetrates the skull, it induces electrical current in the skull, and it causes, let's say, an excitatory or inhibitory effect wherever it is required. And at the end of it, this helps in, let's say, regaining the activity which is lost. There cannot be entire recovery, but at least it shows some scope. Okay? By stimulating the part of the brain which is not working like it should be working. And yehi same let's say is not happening through a magnetic stimulation. Imagine the stimulation was a direct current stimulation, okay, given through let's say all those electrodes aligned on the brain and all of that. This is what we call as transcranial direct current stimulation. Now all of these are still in process. Some of them are experimental, but it has well been established that if you combine transcranial direct current stimulation with other rehabilitative practices, you can certainly make remarkable progress when it comes to dealing with any particular kind of impairment. Yes, Somi, go ahead.
Transcranial isn't very effective for deeper structures of the brain.
Nope. Because you can't, like, it will not penetrate to the subcortical areas, no, so it is very limited areas. That is one disadvantage. That is one very sad disadvantage. Now, guys, this is pretty much everything that I had to cover with y'all. Any questions so far? I have done my best to do justice to all the topics that I could in the limited amount of time that we had. And like I had told you all in the previous lecture, I would have certainly loved to meet all of you in person, because I feel most of you have forgotten how I look like. I have crossed so many of you in the corridor and you all have just walked right through me like you don't remember me at all, and it was very hurtful. very very hurtful, but ठीक है, I am trying my best to not take that personally, assuming that I have put on a lot of weight since the last time I have met you all in class and now. But still, I mean, it was not cool that we crossed each other and you just walked by like you didn't know me at all. But nonetheless, despite that, I have done my best that I could to impart whatever knowledge that I had and could share with you in the limited amount of time. I have shared notes of whatever we have done so far and stuff that I have done today. I will share notes with you in some time. But until then, if you all have any doubts, any questions pertaining to neuropsychological basis of sleep, language, or rehabilitation, traumatic brain injury, questions pertaining to neuroscience, okay, awkward silence. Okay, so I guess you all do not have questions pertaining to these topics. You'll have to give me a few minutes to add the links, the YouTube links that I promised. I will add them to the document and share it with you. Apart from that, if there is nothing else, I just have one final request. Can all of us please switch on our cameras for 2 minutes? I would like to take a screenshot for memory sakes. शर्म करो सालो, शर्म करो, अभी तो ऑन करो. I am only going to have memory of Varada, Somi, Padmashri, Ketki, Unnati, Nidhi and Krisha. Everyone else I do not know. And Sakshi. And Afra and Sonal and Vaishnavi. Don't make me take एक का नाम for you all to switch on your camera. Don't be that juvenile, okay? ठीक है, cool, चलो, give me one wide smile now. Okay, I think Krisha moved while I was doing that. Okay, people, final attempt. Done. ठीक है, thank you so much for not being a lovely audience all the time. But nonetheless, I love you guys. Stay blessed, take care, be happy. And irrespective of everything, my best wishes will always be there with you. Just make something worthwhile of your life and be happy while you are trying to do that. ठीक है? Cool. Now that will be all from my side. I will be ending the meeting. And if at all you see me next time in college, just come and say hi. Don't walk like I'm a ghost and you didn't see me. Anyway, jokes apart, bye guys. Take care, study well. All the best for your exams, okay? See you. Bye bye.
Thank you so much,
Thank you,
ma'am.
ma'am.
Thank you
so much, ma'am, for everything.
You're welcome. All of you. Chalo, bye guys. See you.